Hello and greetings from Divine Cosmetic Surgery. My name is Dr. Amit. I'm a plastic surgeon. I need a bit of your time today so that I can make you understand what hair transplant is all about. I want to finish all your queries, all your questions, and everything that you're confused about hair transplant today, and stuff like price concerns or quality concerns. I will ensure that my team will make all that happen for you, and I will absolutely promise you that you will not find a better value for your hair transplant apart from us. So over the last 11 years, so many patients have asked me many questions, and in fact I have written down some of the points because they are so important to discuss, and these are questions which every one of you will ask me. Whether it's in your mind, whether you actually ask me, but I know it's there in your mind because the last 8,000 or 9,000 patients that I've actually interacted with in these 11 years, they've given me that rich experience. All the objections that run in your mind, the questions that sometimes you hesitate to ask, they're all there, and I've actually jotted down some of those points in these papers below so that I don't miss anything. My purpose today is that I want to take you away from a phase of anxiety or just being curious to being doubtful, concerned about your hair transplant, and I want to take you to a phase where we can impart you trust and confidence. And you know, just be with me, just listen to what I'm going to say, and I promise you will really enjoy these next 7 to 8 minutes, because this is not only coming from a clinic, this is actually coming from the heart. I want to talk to you on a one-to-one basis so that I can clarify a lot of questions which you will not need to ask. Almost everyone who comes to me today is confused. This was not the scenario 5 or 6 years back, and part of the reasons is the amazing mushrooming of centers. Some of them are registered, some are not, and almost everyone that I meet has the very same set of questions. They are concerned about the cost ranging from 10 rupees to 60 rupees, whether this cost is about the follicle or whether this cost is the graft. What is a graft, in fact, and what is a follicle? There are so many things which remain unanswered, and there are so many doctors who are unwilling to answer some of these questions. Another question is, what are the different techniques and what is going to be the best for me? How do I ensure that all the hair that is promised to me is actually going to be implanted? Is my age a criteria for a transplant? Am I too young or am I too old for a hair transplant? Is there a quality control mechanism? How am I ensured, and how do I assure myself that the clinic actually counts the number of follicles that they are going to put in? Can I ensure a smooth progress of the hair transplant process? Is there a QC or a quality control step at play? Am I in safe hands? Is hair transplant safe, in fact? And if it is safe, then am I safe with you? What is my follow-up protocol going to be? Are you going to look after me after the procedure, or do I have to keep calling you up and talk to some person who knows nothing much about the hair transplant process? Am I going to be meeting a doctor? Do I have to pay for any other further consults? If I need anything later, will you actually see me at my convenience? What will actually happen if the result is not as good as promised? What if some hair does not grow? Is there any insurance to that? Will the hair transplant that I want, will it fit my budget? Is there any discount for a hair transplant? Who will be performing my procedure? Is the doctor there? What is the qualifications of the doctor? Or is it just a group of technicians performing the procedure? And finally, why should I choose Divine for my hair transplant procedure? What is special that I should put my trust and money in you? And how can you ensure that my result comes out to be the best? I'm sure these are some in fact the majority of the questions, because these are the majority of the questions of more than 90% of patients who come to me, and these are the very same questions I answer to them. And it is a very sincere request that when you consult a clinic, just ask the very first question as this one, and promise me you will do that whenever you take a consult. Who is going to do my hair transplant procedure? Who is going to do my hair transplant procedure? Is the doctor personally involved in the procedure? Is he a plastic surgeon? Is he a qualified senior dermatologist experienced in hair transplant procedure? Maybe, in fact, I don't blame you if you're not aware of it. Medical Council of India only allows plastic surgeons and senior skin specialists to perform hair transplant procedure. But you never asked the question from the clinic, or maybe it was never in your mind to ask this question from the clinic as to, is the doctor legally and professionally qualified to do a hair transplant procedure, which is a very delicate procedure, in order to get the best results? Sadly, because you don't ask, many Ayurveda specialists or homeopath physicians, dentists, and even MBBS doctors who call themselves as cosmetologists are doing this procedure. If they are doing this procedure, it means someone is getting it done from them, and that someone has not asked the correct question. Would one want to take a risk with their life, and then secondly with their hair, by undergoing a procedure with persons who are not qualified to do that procedure? That's very strange, just because that one question was not asked. Just remember that whatever hair that is taken out from your permanent zone, if it does not grow, it is lost forever. So any loss is a permanent loss of permanent hair. So it is essential, and you must promise me that your hair transplant will only be done by someone who is either a plastic surgeon or a senior dermatologist, and that at least ensures that you get a better result. Now, 59% of all patients, when they meet me, their first question is cost. And for some reason, I don't know why, cost is most commonly the first question. And I always tell them that cost can never be your first criteria of a transplant, because if it was, what you would have done was you would have Googled up, found the cheapest clinic or the cheapest doctor, and already had your hair transplant. But you have not. Maybe you have seen other doctors, maybe you have not. Yet you decided today to come to me. So honestly, though cost is important, but it is not the first choosing criteria, because unless there are some other points, for example, the other questions which I've asked, unless they are answered, cost has no meaning. You probably are looking more for a value, for a confidence, for a trust. So really, if I'm able to establish trust and confidence, cost comes much later, and your result actually comes the first. 31% of patients have always asked us about the safety of the procedure. Is hair transplant safe? And am I going to have headaches? Is my brain going to be affected? Am I going to go mad? Yes, these are the questions which people have asked me. And so let me start at the outset by saying that if your procedure is done by a qualified person, it is an absolutely safe procedure. Come what may, there are absolutely no side effects to a hair transplant procedure, and it is actually zero, as in zero side effects from a hair transplant procedure. And please take that from me. I am an experienced plastic surgeon in hair transplants, and these large number of years and so many patients later, I can tell you there are absolutely no complications.